these bone snips. All you'll need them for on this dissection is just getting through the mental symphysis, through the articulation between the left and right dentary. And the rest of the dissection you can do with your scissors. So you just want to go up there on the incisors. Cut through the jaw. And then take your scissors and trim that up a little. And then the rest of the dissection, we want to stay off the midline. So we go through the midline there because it's easier. And then we're going to go right along the medial surface of the mandible, the dentary, over to the lateral side of the oral cavity and pharynx. And then pull the tongue out between the dentaries. And keep pulling it out as you're cutting along the side of the pharynx back to the larynx and trachea. And so for that dissection, we want to go right along the medial surface of the mandible until we can get far enough to kind of loosen up the lower jaw and start to pull the tongue out. And then we want to work along the side of the oral cavity so that we're cutting down the lateral wall. And as we do that, keep pulling the tongue further out as we work our way back so that you can see which direction you need to be going and try to stay in the side wall there of the pharynx. And then eventually, you'll get back to the base of the tongue and you'll be able to see a little triangular flap in the floor of the pharynx, and that is the epiglottis. So now we can see the epiglottis. It's kind of a little trough-shaped triangle, kind of like a shovel or spade in shape. And that's going to cover the glottis when they swallow. And there's usually a little bit of blood or protein fixed in there, so you want to clean it up a little bit so that you can see. And the epiglottis forms a triangle oriented like this, and when they swallow, it flaps over the glottis, or the opening to the larynx. And so the larynx is going to be just caudal to that. And what we want to do next is continue our cut down the lateral side of the larynx and into the glottis. And the glottis is just a slit between the laryngeal cartilages on either side. And we want to get into that slit so that we're going to open up the larynx as we go through. And what a lot of students do is when they get to this point, they go a little too dorsally and they end up in a tube that's dorsal to the larynx, and that's the esophagus. And we don't want to cut into the esophagus necessarily here. So you want to make sure you're cutting into the cartilage of the larynx or voice box. And you'll be able to see this. I had a lot of stuff in his larynx here. But you'll be able to see the cartilages and the tissue lining the larynx, but it's not very easy to see it in the cat. And so that's why we have the sheep larynxes back in the bucket that I mentioned. So you'll want to see the sheep larynxes that have been bisected or at least dissected into so that you can see the cartilages and muscles that make up the larynx. But in this one, in the cat, once you clean out most of the gunk that's in here, you'll be able to see the palate going back to the soft palate, and the edge of the soft palate is kind of a defining landmark in the pharynx. So the pharynx is where the digestive and respiratory systems come together, and then they separate again as you get back to the larynx. And they come together where the oral cavity and the nasal cavities empty into this common space. and the soft palate separates the respiratory from the digestive pathways. And where the soft palate is located, above the soft palate is the nasopharynx. Between the soft palate and the floor of the passageway, that is the oropharynx. And so it's hard to see right here, but you'll be able to see or find kind of a band of tissue, of muscle with epithelium over it that goes from the base of the tongue up to the soft palate. And that's called the Palatoglossal Arch. And it forms kind of a band or a bar that goes up the sides of the oral cavity. And that separates the oral cavity from the pharynx. And so this part of the pharynx from the Palatoglossal Arch back to the edge of the soft palate, that's oropharynx. Above that soft palate is nasopharynx, and then from the soft palate back to the glottis of the larynx, that is laryngopharynx. So we separate the pharynx into 3 chambers. One above the soft palate, one below the soft palate, and one just caudal to the soft palate. And then where the laryngopharynx is, then the digestive and respiratory split up again, so that respiratory goes into the larynx and digestive goes dorsal to that up into the esophagus that goes through the thorax to the stomach. Okay, and then there's some other structures in the pharynx that they want you to identify as you're looking at this view. And then the next thing we're going to do is open up the thoracic and peritoneal cavities. And so you can do that with your scissors. And I recommend that you clear away any pieces of the pectoralis complex that are still associated with the sternum. And then start your dissection at that first rib that we used as a landmark for the brachial plexus. So remember, I talked about the first thoracic nerve and the 8th cervical nerve wrapping around that first rib before they come out to the plexus. And we can take our scissors and start at that first rib and cut caudally, just lateral to the midline. So in the thoracic and abdominal pelvic cavities, we don't want to cut on the midline because there's midline structures inside that we want to preserve. So we're going to cut about a 1/2 inch or so lateral to the midline. And one thing you want to do is to avoid damaging the nerves that come out there. Keep your scissors, the lower tip of your scissors up against the thoracic wall as you start cutting. And then just work your way down to the diaphragm. And you'll feel when you get to the diaphragm. And we want to go through that into the abdominal cavity. And you can hold it up a little bit so that you keep the tip of the scissors away from the viscera. And go down close to the pubis, but not necessarily all the way. And so that's going to open up the abdominopelvic or peritoneal cavity and the thoracic cavity, at least the pleural cavity on the side that you're dissecting. So this is the left pleural cavity that's open here. Then what I want you to do is to cut a window in the rib cage into the thoracic cavity. And so you can go down to where the diaphragm is. You can tell where the diaphragm is joining those 2 halves. And just cranial to the diaphragm, we want to cut transversely and dorsally. So that we're cutting at the caudal end of the thorax, or the thoracic cavity. And then you can go back to the first rib and start a second cut, and that's going to probably go through the serratus ventralis, so we can trim that away. And we want to use this cut to form kind of the dorsal edge or border of our window. And if you don't cut enough off initially, you can go back and trim some more rib off. And then remove that, and you're looking into the pleural cavity. So we're looking into the left pleural cavity at the left lung. And we can see that there's some tissue that attaches to above the sternum at the midline, and that is the mediastinum that separates the left pleural cavity from the right pleural cavity. And the pericardial cavity and the heart are in that mediastinum. And I'll get back to those guys in a little bit. Then the next thing you want to do is go over to the other side and clear away the pectoralis so that you can find where the plexus is and where that first rib is, and do the same thing just off the midline to the other side, down along the diaphragm, and then back for the dorsal edge of that window. That way you can see in on both sides of the thoracic cavity, or cavities. And then a little bit later, we're going to continue this cut from this window to that other window you're going to make, and then reflect the sternum, keep it attached up here, but we'll reflect it here so that we can get at the whole pericardial area as we're looking in the thoracic. In the abdominal, we want to go just caudal to where the diaphragm attaches to the body wall, and just cut flaps on either side. So you can cut down here and then cut across, and you'll be cutting across the midline, but that's all right. And then you can use that to expose the peritoneal cavity and the abdominal viscera that you'll get to a little bit later in this week's stuff. Okay, now on the board, I've drawn a couple of illustrations about cavities. One is kind of general cavity formation, the drawing on the right, and then the one on the left is specifically with the thoracic cavities, because the terminology of the structures you need to identify in these cavities can be kind of confusing and difficult to understand unless you know how these cavities form. So as a cavity is forming in our bodies, we'll have a space forming around, and an organ or organ system growing in that space, and that space will grow outward and push against the body wall, and that space is surrounded by a membrane. So it's like a big bubble or balloon, and it grows. And it pushes inward on the organ, the viscera, and it pushes outward on the body wall. And so that forms or produces two membranes that one lines the outside of the cavity. And so on the inside of the thoracic cage here, we can see this shiny tissue. That's a membrane, which represents the outer part of that balloon. And then on the surface of the lungs, we have a membrane that represents the inner portion of that balloon. And the portion on the body wall we call the parietal layer. And so in the case of the lungs, it's the parietal pleura. In the case of the peritoneal cavity, you see this shiny surface on the inner wall of the belly wall. That is the parietal peritoneum. On the organs, like on the liver here or on the lung here, is the inner portion of that balloon, and that's the visceral portion. So that's visceral pleura on the surface of the lungs, visceral peritoneum on the surface of all of the organs in the peritoneal cavity, at least the ones that are covered with visceral pleura. This is the mess. And where those come together, where the balloons, so this occurs as a pair. Each cavity is a pair of balloons, one from the left side, one from the right side. And they each push outward against the wall to form the parietal layer. They each push inward against the organ to form the visceral layer. And where they come together, they form a mesentery, or a strip of membrane that attaches the organ to the body wall. And so if we look at the digestive organs, for example, here, you can see that mesentery that attaches along the digestive tract. That is a mesentery, and that's where those balloons from each side met. And that's illustrated on the board up there. You know, most of our cavities form with dorsal and ventral mesenteries. In our peritoneal cavity, the ventral mesenteries are mostly lost. So all the mesenteries that we see attaching the organs to the body wall are dorsal mesenteries, or elaborations of those. And we'll see that more once we start to get to the organs. Now, in the chest, in the thorax, that's complicated because you have a cavity, you have three cavities forming side by side. You have a cavity around each lung, the pleural cavities, and you have a cavity around the heart, the pericardial cavity, which forms within or in between the two pleural cavities. And so they each have parietal layers that are pushing out from that cavity. They each have visceral layers that are pushing in against the organ. So each lung is covered by visceral pleura. If we dissected out the heart muscle itself is surrounded by visceral pericardium. And there's a cavity outside of that, and then there's the parietal layer of the pericardial cavity that's pushing outward against the parietal layer of the pleural cavities on either side. And those two layers pushing against each other form a sac. And that sac surrounds the pericardial cavity. So that sac is the pericardial sac. So when you're cutting into the pericardial cavity to get to the heart, you're cutting through parietal pleura, you're cutting through parietal pericardium, and then that opens up the pericardial cavity. And the parietal pleura and the parietal pericardium together make the pericardial sac. So that's what the terminology is all about. Now, as you read the descriptions, as you get to the point where you're looking at the mediastinum, or the stuff between the two pleural cavities, then it should make a little bit of sense if you know what those layers are made up of. And again, mediastinum is everything between the two pleural cavities. So the heart, the pericardial sac, the pericardial cavity, that all sits in the mediastinum, which literally means to stand in the middle. So that's all the stuff you see when you're looking from one side to the other. Okay, that's it. That's the beginning.